Did you know you should not feel bad during your menstrual cycle? Did you know you shouldn't feel crampy, you shouldn't feel PMSy and grumpy and moody and full of anxiety, that you shouldn't be flooding and bleeding so hard you can't leave the house, or bloaty? And did you know that there are healthy and natural things that you can do that don't involve birth control pills and bioidentical progesterone creams to make you feel better? I didn't realize what a mind-blowing concept that was to so many women until one day I was talking to a prospective patient on a phone call, because we do these 10-minute complimentary phone consultations with people who were just kind of checking me out, wanting to ask questions, seeing if I can help them. And she was kind of, well, should I even be thinking about that I can improve my life at all? Because don't all women have bad PMS? Don't all women feel miserable during their cycles? And then she mentioned to me that even her gynecologist had said, take an ibuprofen, just get used to it. This is just how it is. And no, that is not how it is. It just kind of makes me want to jump out of my skin. You should not have any symptoms around your menstrual cycle, and you shouldn't feel miserable around perimenopause. Other than the bleed, maybe a little temperature change during menopause, you really shouldn't have any symptoms. And when I told her that, she was, no one's ever told me that before. And she literally said, mind blown, and I forget that a lot of women don't realize that. You watch commercials, media, we're just kind of trained to believe it's going to be miserable. Menstruation is not a disease state, and it shouldn't feel that way. It's a common problem, but it's not, how it should be. And so this has spurred me on to want to talk about this more with you. So we are developing a new segment called Ask Dr. Maureen. So you can write in, you can send them an email and Facebook to send in all of your burning menstrual and menopausal and perimenopausal concerns. And I'm going to start with some of the questions that I get asked most often while I await your questions. So write those in for us. We're excited to get them. So we're going to be talking about cramping and what causes PMS, and real things, simple things that you can incorporate in your life, things to make your life better right away at home. We're going to talk about those things. We're going to talk about liver cleanses and smoothies and great recipes and diet. We're going to talk about herbs. We're going to talk about libido. We're going to talk about what are bioidentical hormones and when's the right time and place to use them. They're not my favorite, and we're going to talk about how bioidentical hormones aren't as natural as they make you think they are, and there are some dangerous things with them, but there is a time and place for them, and we're going to talk about that. We're going to talk about PMS and moodiness and all that irritability that sometimes women can get. We're going to talk about, again, libido and fibroids. We're going to talk about it all. And of course, we want your questions, so don't hesitate you can message us through Facebook, you can send them in through email. Of course, we won't mention your name. But you know what? I've been there. I had menstrual problems and fertility issues in the past, so I understand and I can help. And I love doing this. It's one of my favorite things to do. I love talking about this stuff. So I relish getting your questions and talking about that. And we're going to release a video answering some of the most common questions and your questions every week. And remember how just a few minutes ago I mentioned a woman who we were talking on the phone? Just so you know, you can do that too. And we're going to put a link to that. So if you're not already a patient here, you can, through the link that we're going to put on this message, you can schedule a 10-minute consultation with me if you would like, just to talk, see what I do, talk about your concerns a little bit, see if I can help, what my perspective might be, to see if I'm a right fit for you. So you're always welcome to do that. If you're a current patient, I hope you already know you can always reach out to me. We're always doing quick checks, and you're always welcome to send emails and touch base with us in between your appointments too. For those 10-minute consultations, if you're not a patient, they're there for you. You can do them. How often do you get a chance to talk to the doctor for free for a few minutes? And remember, on our website, we have perimenopausal and menopausal quizzes and menstrual quizzes. So they're going to be asking you questions, things you really shouldn't be feeling, just to see if you are. That means there could be possibly a problem. And we're going to put links to some of those quizzes on this as well. So take those, they're kind of fun, they're kind of interesting. Send us in your questions. As always, we're going to have a great recipe attached today and in all of these other weekly messages we're going to send you. So remember, ask Dr. Maureen. I can't wait to get your questions. Have a great day, and I'll see you next week.